So what we notice is that when the same child was seen for speech and language therapy, and then which is using iPad and cards and things like that, but when we put in VR, the spontaneity in use of expressive language was quite at ease, I must say, because it was quick, and the child was immediately identifying the colors, identifying the vocabulary that we didn't see before. Was something that we noticed, that whatever we have been giving them, it is there in there, but the VR was actually tapping that vocabulary out because of the activity. So we could hear things like beach ball, basketball. That was great. I mean, we have only taught them during sessions, but then we don't see it unless and until we push them. And this was spontaneously, as soon as there was a change, they would say, "Oh, I see a circle. I see," so then we say, "Okay, can you keep the ball to the circle?" "Oh yes, let me look at it." And then they do that. That was great. And also another incident that we noticed is that the student had a lot of echolalia. So anything you say, he repeats. And what we noticed in this is that was reduced. So anything that we asked, he was responding to the question, because probably it was not, it was there in his eyes, and his attention was there, his focus was there, and he was focused to say what was happening, and there was a change that was happening, and that was something that we noticed. So during the trial period, this is what we noticed. But I think if it is continued, we might see changes elsewhere as well in another setting. It's a possibility. And even if you don't ask them to be able to say it, is something that we are looking at. Because communication skill is all about that, where we see something and we are amazed about something, we use our language spontaneously. And that is what we want. And when kids can do that, that's an achievement for us. Since it was within the therapist that was being done, what we noticed is that within the session we did get a lot of attention, and also to see that they could make a difference between virtual and reality. Some of them, as young as like a 6-year-old, trying to move and see that, okay, that's virtual and this is reality. That was good. And what we noticed within the session, after that, when we did a speech therapy session, they were with us for the activity. Adaptation, there was an issue with few kids, but that's just a handful, maybe 2 or 3 maybe maximum, but not more than that. But they could adapt it within like a 2-session time frame. They were able to, unless and until there was one child whom we had to pull him out of the training because he was not ready, but it's also due to other factors. He was in a sudden change of medication, and that was the reason. It was not per se this. It was just more of that, and and most of the students were on the spectrum and diagnosed with ADHD as well. Yeah, that was quite. We were quite happy with that because it was quite quick, the adaptation. Because I think with the experience that they have now with iPads and things like that, that was quick. And I could see that it was not that we had to wait for 3-4 sessions for them to have a change. Even if we do it within that one setting, if we do 2 guides, the exercises, it was easy for them. Right. They were ready to adapt it. So that was nice. The motivation to come and do it again was something that we were happy with, because there are some children who refuse to come into therapy sessions at times. But then if it is like, let's go put the VR, and then they are ready to come in. So that was good in some kids, and they were ready for it.